It's the Todd Ortloff Show on News Radio KONP. Now, here's Todd.
All right, welcome once again to the program. Going to spend the first part of the show today getting to know somebody new in our community who's taken over for at NOHN as the CEO there, and we welcome Terri Sabella in. She's actually been at that job for a few months now, but this is our first chance of having her on the radio to talk about what she's doing over there. And also, it is National Health Center Week, and that's the other reason that we have Terri here. So it's great to meet you on the radio finally.
Nice to meet you as well.
Thanks for coming in. Just a little bit about you. I'll let folks know kind of how you ended up here in Port Angeles, where you've been.
Certainly.
Yeah.
So it's a long story. I won't make it long here, but when people ask me where I'm from, I always stumble. I was born in Baltimore, Maryland, but had a family who worked in different states. So lived in Minnesota for a little while, landed in Texas in my teens, and have been there with the exception of about 3 years that I lived in Tennessee for a job there. My career, I started as an ER, ICU, and trauma nurse at Parkland in Dallas. So a very large hospital. Unfortunately, most people, if they know it at all, think about JFK when they think about Parkland, right? Yep. So I was there for about a dozen years as a nurse. Loved that job, but was looking for what came next in my future. Went to law school, became an attorney, represented other healthcare providers, hospital systems, things of that nature. But one of the things I loved about Parkland was we were considered what they call a safety net hospital, meaning we took care of everyone regardless of their ability to pay. Our funding was supported by the county. And so I missed that part of my career. And so I joined my first community health center as their attorney. I was their attorney for a couple of years, became interested in leadership. I have a PhD in healthcare management and health policy, and so then began my career in community health center leadership. Most recently, I was in Brazos Valley in Texas, which is north of Houston, east of Austin. It is a 9-county region. If people have heard of it, it's probably because they follow college football. Texas A&M University, one of the largest public universities in the United States. Other than that, it's a very rural community, and we served a 9-county rural community there.
All right. So coming here, you did a little practice only in Texas, maybe like everything in Texas, a bit bigger. Even rural's a bit bigger there, right?
It's true. It's true.
Yeah.
Yes, the health center was a little bit bigger. The community we served was a little bit broader. But yes, certainly experience in rural healthcare delivery, which is challenging.
You have a very interesting background because, if I looked at your title and I'm going, wow, she's got a lot of degrees in that sense. But as you described it, each one, I think, carried you into kind of a different aspect of this and probably brings a toolkit to a job like this.
It does. It does. It kind of makes me a little bit of a jack of all trades. I tell people as the CEO, my job is to be the ultimate generalist. I have a wonderful team here that has folks with very deep specialty expertise in each of their roles. And so my background allows me to have enough understanding of what each of them bring to the table to be able to kind of bring us together, kind of like a conductor with a symphony.
Yeah. All right. Well, welcome.
Thank you.
A little break from the Texas heat for you up here as well, I think.
It is amazing. My husband hasn't finished the move. He called the other day and said it was 104 degrees.
And you did just that, probably laughed and said,
I did laugh.
You better get here.
I said it's 74 here today. He was very jealous.
Yeah. All right, let's talk about NOHN. We've had Dr. Maxwell on many times to talk about this, but I think it's a good chance to revisit what NOHN is and really what it isn't. So this is a unique type of a healthcare center.
It is. And it's unique circumstances that took us to where we are today. So as you mentioned, it is National Health Center Week this whole week. And so part of what we do during National Health Center Week is it's a time to kind of educate people, bring awareness to the community health center movement. It started back in the civil rights movement, the community health center movement. So it's been around for quite some time. Today, community health centers serve over 52 million Americans. So quite a broad reach across the country, over 1,500 organizations doing that with over a vast number of service sites. So Dr. Maxwell and his colleagues back in the day had a private practice, so folks who've been here a long time know that. They realized at some point that that private practice was not able to serve the whole community. There were some barriers. By turning it into a community health center, it allowed them to leverage a federal grant. So there's a federal grant that helps offset some of the care provided to individuals who are unfunded. And then it also allows them a different type of payment mechanism with insurance companies, Medicaid, other payers that makes the organization more sustainable for the long term while caring for everyone in our community, regardless of their ability to pay. There's a couple key features about community health centers. One of them that I love to bring to people's awareness is the fact that we are a nonprofit organization that's governed by a local board of directors. That local board of directors has to be at least 51% consumers of our services, meaning patients. So the patients govern and guide the organization. They are the ones that decide what our hours should be, where our locations should be, what type of services we should offer. My job as the CEO is often to bring them the information and allow them to make those decisions. So they are really guiding us as the community members. So while we have that federal tie that gives us some fiscal advantages, and we certainly have an obligation with regard to reporting for transparency, financial reasons, quality reasons, the governance and the decision making is local to the community.
So if I go to another community health organization similar in another community, if I go back to where you came from, they're going to look a little different than the one would here.
Yes,
simply because of that.
There's a saying, you've seen one community health center, you've seen one community health center, and it's very true. Different communities have different challenges. In some communities, it may be about transportation. In some, it may be a food desert that you're grappling with. One of the great things about community health centers also is we're really patient-centered. So while we have the typical primary care services you think of, so you go to your doctor for medical care, we also have a variety of other services. We try to make sure that we provide care to the whole person. So we have pharmacy, we have optical, we have dental, we have behavioral health services, we have addiction treatment services. And then for the rest of the individual needs, things like food insecurity, housing insecurity, we partner with local organizations. So we can't be everything to everyone, but we do try to take a very broad perspective and know that those things really influence health. Mm-hmm. And so we partner with other organizations that can fill in some of those gaps.
Suffice to say, though, a lot of the broadness of NOHN, I think, comes from the fact that there's a lot of access issues here. I mean, that's been a struggle. I'm sure you've heard about that. That was one of the reasons I think Dr. Maxwell and et al. Decided they could do something like this, because there was a need to get people physicians. I mean, waiting lists were long. Well, they're still long, but it was taking years and years for people to get in with a doctor, just because of the way the nature of the business here locally.
It's absolutely true. One of the keys to having a healthy, thriving community, both in terms of physical health and also the financial viability of a community, is having access to healthcare services. If you don't have healthcare providers, you see other things start to fall away as well. I think prior to this shift, they were having some significant challenges in recruiting healthcare providers to this community, particularly primary care providers. Everyone has probably heard of the primary care shortage. Well, we here in Port Angeles and the surrounding area felt it as much as anyone. So becoming a community health center makes it a little bit easier for us to recruit. And then there was one other thing that they thought of, and that was they have a residency program here. The residency program is such a win. All the studies tell us that when people have the opportunity to train in their medical residency training in a rural community, they see the benefits of life in that rural community, and they're way more likely to continue to serve in that rural community. So we have at least 6 residents at any given time that are here serving this local community on a regular basis. They stay. Mm-hmm. We have brought a number of individuals to the community that are now physicians serving this area. And when they leave, they don't leave to go to an urban area. In most cases, even when they leave, they go serve another rural community. So it's another service that we provide.
Talk a bit about like Medicare reimbursement. Do you have a better rate than, say, if a private practice tries to bill Medicare, for example? Because that's a real barrier.
It is a real barrier. So Medicaid and Medicare, because of the relationship with the federal government, we have something it's referred, not to get too jargony, but it's an alternative payment mechanism that takes into account what the cost is of delivering care to our patients. You know, I told you about the fact that we have all these different service lines that we're providing. We also have nursing case management and care coordination, referral management. We help people with eligibility when they want to get onto Medicaid, or if they're having trouble finding out if they qualify for a service. We look for grants to help support care. All those things cost money. There are additional layers of expense. And so with the arrangement that we have with CMS, who governs Medicare and Medicaid, they look at our cost reports, that transparency I told you about, the financial transparency we're required to have. We turn in those financial reports, and they look at that to determine how much we're reimbursed for the care that we're providing. So it's way more sustainable to provide those Medicare and Medicaid visits at a community health center than it is in a private practice.
Although you haven't been as part of the ramp up into some of the I'll call them extra, additional services might be a better way to vision, pharmacy, all of these things that were kind of added on as this, NOHN grew from just kind of being primary care stuff. Take us a little bit through that, though. Has that been a challenge in some ways? Because it's taking on a lot of different, lines of service, if you will.
It is. It's a bit of a balancing act, and it's difficult because you can't swing the door all the way open and say, oh, now we have vision for everyone. You have to take it a little bite at a time to make sure that you don't jeopardize the stability of the rest of the organization. And so I think that they've been very careful in how they've grown these different pieces, but they're really thriving. They're doing very well. That's not to say that they're not at risk. I think that we are staying in touch with our legislators right now. There's been some discussion of some of the challenges they have on the state budget level, and I think last legislative session they had talked about possibly cutting the Medicaid adult dental benefit. If that were to occur, it's not that we wouldn't take care of those people anymore. It's that those people wouldn't be reimbursed at that Medicaid rate anymore for us. And instead, what we would be using is something we have called a sliding fee scale. So for our patients that don't have any type of coverage, we invite them to visit with our eligibility team, provide their proof of income, and then we place them on a sliding fee scale where they get to pay an amount that's proportional to what they're earning, right? So that it's not a barrier to care. Now, while we were able to avoid that elimination of the adult Medicaid dental benefit last legislative session, we're told that this year they're having a tough time again with the state budget, and it's on the table again. So we will be reaching out to folks saying, if this is something that's important to you, if you want to make sure that NOHN can keep providing these services and these benefits to folks, we're going to have to make sure our legislators know that we need that reimbursement.
I find it interesting, too, when we talk about dental. It's a great example. That's just, you're not really intruding on the number of dentists we already have here. There's a need for these services. That's part of the reason that you've taken them on. Not necessarily to displace or replace anybody here. It's just there's a void.
We could have a whole conversation about oral health. I mean, oral health is very much tied to physical health. Right. Patients who are dealing with chronic disease, you need to be very attentive to their oral health. Pregnant moms frequently experience issues with their oral health. Most people who have insurance that covers dental, it's not great coverage, right? It does get you some contractual discounts and a modest amount of coverage, but there are a lot of people who need significant reconstructive oral health care who don't have access to it. And yes, we're not intruding. There is a need for way more than we have right now. And it's not just Port Angeles or Clallam County. It's nationwide. This is such a challenge.
Yeah. Behavioral health, you're doing some work there as well. Maybe talk about that.
Yes. So we have a behavioral health team. So there's counseling services available, there's psychiatry available, and we're looking at how we can expand that. We know that that's a growing need in our country and in this community, and we have a wonderful team that is providing also access to some addiction treatment services, which again is another significant need.
So how do you map out the strategy? What, when you get together with this board, I mean, as to what we do next, what we can sustain, what's working, what's not?
That's a great question. So at least every 3 years, we do what's called a community health needs assessment. And then that feeds a strategic planning retreat with our board, where we sit down and we show them what the analysis looks like. What is the need in our community? What does the legislative impacts of things that we know are coming look like? How are they going to impact us financially? What is our fiscal health, our financial health as an organization? We talk about what the community partners are able to do with us, what challenges we can anticipate, what opportunities that we have, what our patients are saying their need is. And then we sit and map out and prioritize what the community needs are. I frequently tell folks who get overwhelmed, you can't boil the ocean, right? We have to take this on one piece at a time. But that's one of the wonderful things about that community-based board is they really have their ear to the ground. They understand what the patients are feeling, what the patients are needing, and they provide that voice in that decision-making.
How many patients do you serve now?
So here at NOHN, I believe we exceeded, I'm looking for my number, but I believe it was 17,000 in the last year. Yeah. I think that's right.
I only bring this up because if NOHN were not here, that's 17,000, patient visits or whatever that would have to be absorbed somewhere else. And anybody that is trying to access any sort of health care realizes that even with that in place, it's still a struggle. I couldn't imagine what the community it doesn't have the capacity to absorb that.
No, that's absolutely correct. And if you think about the fact we have 13 physicians on staff, we have 9 advanced practice clinicians, which are nurse practitioners, PAs, and then 6 residents. That's a lot of providers, a lot of clinicians seeing patients. If those individuals weren't here, that's quite a gap that would have to be filled.
You're separate from OMC. I think people need to realize that because I think sometimes people think you're one and the same.
Right. Close partner, but not the same. We are different organizations. So but I will say I've been around communities where they didn't have that partnership with the local hospital, and it presents quite a challenge. Here, it's not just the hospital, but all of the different organizations that provide care are really so collegial and very partnership focused. And so we are close partners with OMC, but not the same organization. Right. We are a local private nonprofit.
All right. You alluded to Medicaid issues with the dental program as well, but let's talk about kind of some of the other things that are brewing in the background, because it's not all rosy out there at the state level, rough. Certainly, and the federal level has got some things going on too. So give us your lay of the land right now. Yeah,
it's rough all the way around. It was interesting to go through the global pandemic, and then not everyone understands this, but during the global pandemic, what happened was they said anyone that was on Medicaid or came to access Medicaid during the pandemic was not going to be dropped off of Medicaid until after the end of the pandemic, which meant that the Medicaid rolls grew significantly. Mm-hmm. A lot of people had access to Medicaid during that time. They didn't have to submit a lot of paperwork during that time. Their continued eligibility was assumed. And then when the end of the global pandemic was announced, all of a sudden, there were a lot of people that lost access to care. That was not only devastating for the individuals, but it was really difficult for the health centers and other providers who continued to provide access to care for those individuals, but now again on a sliding fee scale because they no longer had coverage. Now, fast forward a little bit, and we see some of the new policy with the work requirements impacting those folks who have access to Medicaid. They're going to have to be proving that they are involved in eligible activities or have some type of medical exemption. And they're going to have to prove that again and again and again over the course of a year. One of the challenges I've heard, and I have not validated this myself, is that they don't even necessarily align all the members of a family with the same eligibility dates. So you may have to be bringing paperwork in for your kids on a different cadence than you're bringing it in for your. It's really challenging. We've been talking to the folks at the state level, at the state Medicaid agency, and they're trying to help us figure out how to navigate it with the least impact to the individuals possible. But it will have impact. There will be folks who lose coverage. There will be folks who struggle with getting this documentation submitted and submitted timely and will fall out of care because of this. And the challenges of falling out of care sometimes are many times what we're talking about is people who are the working poor in our communities. Yeah. It's not that they don't have a job, that they're not engaged. It's they're working an hourly wage job. And now are we going to ask them to take off work to come submit these documents on a regular basis and go through what is a very complicated process? I have helped people with this process, and I have a PhD in healthcare management, and I'm struggling with making sure all these boxes are checked the right way and the paperwork submitted right. It's just, it really is quite a burden, and I'm concerned that those people will have to prioritize going to their hourly wage job.
Or getting their health care, really. I mean,
versus getting their health care, which means when you see them, you're going to see them when they are sicker, when they're unable to go to work, when they're unable to care for their families, when they're in the emergency room because their chronic disease has gotten out of control, instead of allowing us to be proactive and manage those things.
And
together.
Some of this also spills into the private insurance too. And I mean, that even has an effect, right? Because you've mentioned, I know a lot of folks that, they've had businesses have had provided a benefit. They can't afford it anymore because the rates for the premiums have gone up so much.
They've gone up dramatically year after year after year. I mean, even for us as a community health center, I know when we go out to market to look for the benefits for our own staff, and as a healthcare provider, I find it unacceptable that I would not be able to make sure that our staff have access to a quality healthcare benefit. But every year we're talking about increases of 30% in premiums. Well, we're not getting paid 30% more to deliver services. And that's not just for us. That's all these businesses. Right. And many small businesses, your local plumber who may just have a couple people on staff, they can't afford to provide those benefits for their employees. It's just too costly. Right.
Which is where, having a known in our community is a good thing, because
Absolutely.
It really is it is an ultimate safety net in a lot of ways as well. I think we'll have to have you back to talk about some things, especially as some of this stuff starts to bubble up. I'd love to chat more with you, Terri.
I would love to come back and talk some more. And in the meantime, I am now here in the community, and I welcome visitors, anyone who would like to be a part of what we're doing, anyone who would like to partner with NOHN, please look me up, come visit me. I'd be happy to have that conversation. I think the more we all work together, the better we can serve our community.
All right. Thanks, Terri.
Thank you.
That's Terri Sabella. She is the new CEO at the North Olympic Healthcare Network, known here locally. And we have her not only because she's new to town and the job, but also because it is National Health Center Week this week as well. We're going to take a break. We're going to talk a little bit about the Port of Port Angeles when we come back right after this.
This is the Todd Ortloff Show on News Radio KONP.